Imagine enjoying a meal that tastes heavenly at the moment only to face the wrath of indigestion hours later. It's a common scenario that might leave you wondering what went wrong. Certain foods, while delicious, can be notorious for wreaking havoc on your digestive system. Identifying these culprits can be the first step towards better gut health and overall well-being. Your digestive system is a complex and sensitive biome that plays a crucial role in your health. However, some foods are harder for your body to process, leading to discomfort, bloating, and stomach woes. Knowing which foods to avoid can help you make smarter dietary choices that enhance your digestive health rather than impair it. Let's dive into understanding which foods might be the worst offenders and why steering clear of them could be better for your digestion. First, animal protein consists of red meat, poultry, fish, and similar. While these are healthy and rich in nutrients, they can be harmful to the gut microbiome if consumed in large quantities. Research shows that too much animal protein raises your risk of inflammatory bowel disease, IBD, a condition that worsens the health of your gut and triggers unpleasant symptoms. Excess animal protein can also increase the risk of cancer, heart disease, osteoporosis, and kidney damage. So while it's okay to include animal protein in your diet, aim to consume a lot of plant-based protein sources as well. Citrus fruits, including lemons, limes, oranges, and grapefruits, are rich in citric acid. You may find these acids causing acid reflux symptoms such as throat pain, nausea, and heartburn. An increase in gastric acid production is another consequence, potentially causing it to rise into your esophagus. Although eating citrus fruits in moderation isn't detrimental to your gut health, high consumption leads to issues. It's advisable to limit yourself to one citrus fruit every 2 days. For those with IBS or acid reflux, consider reducing your intake further. Acidic foods. Acidic foods can intensify the acidity of your digestive tract, inciting symptoms related to acid reflux and GERD. This category causes stomachs to generate excess gastric acid, which can ascend into your esophagus and lead to heartburn. Common acidic foods comprise fresh and processed meats, eggs, salt, specific cheese types, and certain grains. To mitigate these effects, incorporate alkaline-forming foods such as fresh vegetables, soy, herbs, most non-citrus fruits, and particular soy products into your diet. Next, fructose-rich foods. Fructose, a high FODMAP sugar, naturally found in fruits, is harmless in small doses, but harmful in excess. Excessive consumption may lead to gut issues, since all sugars pose a digestive challenge, particularly if you have GERD or IBS. Additionally, high intake of fructose can increase the transfer of toxins from your intestines to your bloodstream, causing inflammation and elevating liver fat, which negatively impacts gut health. To boost gut health, consume fruits lower in fructose, like bananas, blueberries, or strawberries sparingly. Artificial sweeteners. Artificial sweeteners contribute to inflammation and damage to beneficial gut bacteria, ranking them worse than sugar. While the complete avoidance of artificial sweeteners remains debatable, limiting their intake helps maintain gut health. Tomatoes. You might not expect it, but tomatoes and their products rich in acids can initiate inflammation within the digestive tract. This potentially results in bloating and abdominal pain, especially for those with IBS, GERD, or acid reflux. Moreover, tomatoes are a common allergen. Checking for allergies before increasing your tomato intake is prudent. Spicy foods. Spicy foods can cause widespread inflammation in your digestive tract, triggering acid reflux and GERD symptoms. While they're sometimes touted for their anti-inflammatory properties, the actual impact varies. Pay attention to your body's response before heavily integrating spicy foods into your meals. High FODMAP foods. Foods high in FODMAP, such as artichokes, garlic, onions, apples, mushrooms, and cauliflower, can inflame and damage gut health by triggering various IBS symptoms. Limiting intake of such items can aid in preventing discomfort. Dairy products. Dairy products, while beneficial due to their probiotic content, if overconsumed, can promote inflammation, indigestion, nausea, stomach pain, and diarrhea. This reaction owes to various indigestible substances and nutrients found in dairy. It's crucial to monitor both the amount and frequency of dairy consumption. Cabbage. Cabbage, a cruciferous vegetable packed with essential nutrients and antioxidants, poses digestive challenges when overeaten. Excessive consumption may lead to flatulence, diarrhea, and medication interactions. Given its digestive complexity, those with slow digestion should be cautious about their cabbage intake. Processed food. Avoiding processed food can significantly benefit your gut health. These foods, often laden with trans fats, sugars, salt, preservatives, harm the microbiota in your gut. They're also calorie dense, with excessive consumption correlating to weight gain, which exacerbates digestive issues. Steering clear of items like frozen pizzas and canned vegetables is advisable. High sodium foods. High sodium intake is detrimental not only to cardiovascular health, but also to gut health, leading to inflammation that disrupts healthy gut bacteria and causes water retention. This can result in feeling bloated and impede digestion. Soy. Although some experts consider soy as safe, it's prudent to limit soy-based products in a gut-friendly diet, primarily because most soybeans are genetically modified. GMOs and anti-nutrients present in soy might interfere with mineral absorption and weaken the gut barrier, factors contributing to gut issues and inflammation. Legumes. While generally accepted in moderation, legumes can lead to leaky gut syndrome when consumed excessively. This condition results from damage to the intestinal lining wall, allowing toxins into the bloodstream. Legumes are also high in FODMAPs, which can cause bloating, nausea, diarrhea, and constipation. Navigating the maze of dietary choices for optimal digestive health might seem overwhelming, but understanding the effects of certain foods can empower you to make informed decisions. If you've experienced discomfort or adverse reactions from any of the foods mentioned, it's worth considering adjustments to your diet. Listening to your body and possibly consulting with a healthcare professional can guide you toward a diet that feels right and supports your digestive system. Remember, every step you take towards better eating habits contributes significantly to your overall health and well-being.